Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. And it seems that despite not having enough money to run an NHS, Scotland can spend 130 million on private medicine. Hypocritical much? This is the Scottish health boards that are spending this. They're pushing people into the private medicine because they haven't got the capability of doing it in the NHS. It's a massive amount of money that, if invested properly, would not need the requirement for all this. But of course, they haven't got the availability to invest it properly. They're not allowed to invest it properly because the SNP need to micromanage every single penny that goes on in Scotland. They've got to be involved like a metastasised cancer at the heart of every single thing that happens, rather than trusting professionals to go and do their jobs. So we'll take a look at this piece to see what's going on and why so much money is being thrown out of the NHS and into private medicine from public money. Here goes. So SNP accused of shameless hypocrisy as figures show health board spent £130 million on private care. This comes out of the health board's funds. This is public money. And they're throwing, and it's for the good of patients, I'm sure. But why are you spending it on private medicine instead of investing it in your own hospitals, hiring the doctors, nurses, care facilities? Get these things done. And then you've got them, you own them. You don't have to keep giving money to a private organisation that is plenty rich enough as it is. Anyway, new figures released under the FOI show that the amount given to the private sector for treating NHS patients is on the rise under the SNP-led government. It's basically they're so embarrassed by the waiting list, and they have targets to reach, that they're taking people off the NHS waiting list, throwing them into private, simply in order to get them out off the list, to make the list look better. But it doesn't actually help the NHS as a whole, because it's money that would be more efficiently spent within the hospitals. It's ridiculous. Anyway, the SNP has been accused of shameless hypocrisy after it was revealed the Scots Health Board has spent almost 130 million sending patients to private hospitals. Humza Yousaf party this week urged Labour to rule out the privatisation of the NHS, which is odd considering it's the NHS that's now privatising itself. They hit out at the expanded role for the private sector and dismissed Labour leader Sir Keir Starmer as a Blairite. Oh, if only. The Daily Record has reported that new figures released under the FOI show the amount given to the private sector for treating the NHS payments is on the rise under the SNP-led government. And of course, who's the current health secretary? It's Jenny Gilruth. But you can't really blame her because this is historical figures. You have to look at who was the last health secretary. Someone perhaps who didn't know what he was doing. Someone who was panicking. Someone who said, just get them off the list. Pay them to go private and get them off the list. Who could that possibly be? Ah, yes, we know. It is our blessed leaderine, Humza Yousaf. Anyway, in 2018-2029, I think they mean 2019, bad journalism again. Nobody proofreads these things, do they? The total stood at 24.1 million before surging to 32.7 million, then falling back to 15.4 million in the first full year of the pandemic. It rose to 24.2 million in 2021 and then jumped again by 10 million, nearly 10 million, to 31.4 million pounds last year. That is a hell of a lot of money for the NHS to be spending on private medicine. So the last 5 years, £130 million. It's ridiculous. In NHS Lothian, the biggest beneficiary of public money was Spire Murrayfield, which received more than £4.5 million. NHS Lanarkshire spent around £15 million at Ross Hall and Kings Park facilities during the same 5-year period. The total since 2018 alone stands at £128 million. Who's signing off on this? Who's allowing this? It must have been previous health minister. He's the only one who could have authorised this kind of expenditure. This level of expenditure is beyond what hospitals would be allowed to spend. So this has come directly from Humza Yousaf himself in some vain attempt to shorten the waiting list so it makes it look as though he is an effective health minister. But in actual fact, the effect of it is to take out £130 million from the NHS that would be far, far more efficiently spent within the NHS dealing with people there quicker, faster, pushing them through the lines quicker. But he needed that short-term boost to show we have reduced waiting times. I am the great saviour of the NHS. He's destroying it. Anyway, Labour MSP Jackie Bailey said, this shameless hypocrisy from the SNP. Said, under this nationalist government, thousands of patients have been forced to go private due to the SNP's catastrophic failure to support our NHS. And while the SNP amp up the rhetoric, they are spending more and more than ever on private providers because of SNP incompetence. The truth is that the greatest threat to our NHS is this SNP government. I could say more at this point because Merlin, my source, told me something directly related to this. And I'm biting my fingers because I really want to say. But I've given my word that I won't. But it's really, really relevant to this. But it's something that will come out. Waiting lists are now so long that £128 million of taxpayers has been spent paying for private healthcare because the NHS cannot cope. It was the Labour Party that founded Scotland's NHS, and it will be the Scottish Labour Party that saves it from the SNP privatisation by the back door. Scottish Lib Dem leader Alex Cole-Hamilton, who unearthed the figures, said, for a government that goes out of its way to proclaim its progressive credentials, I think the public might be surprised by how much NH work is being contracted out. I'm not surprised. He needed headlines to show how good he is. And the only way he could do that is to reduce waiting times. And the only way that could happen is if the people stopped being waiting. In other words, get them through, get them out. And so he's authorised this payment to go out to treat people privately, to shorten the waiting lists, so that he could say, we have shortened the waiting lists. But at what cost? Absolutely, what cost? It's clear that private healthcare providers have a role to play, whether that was offering extra capacity during the pandemic or providing specialty treatment that is not economical for each health board to provide itself. However, the public should be kept in the loop about the decisions that the government and health bosses are taking. I'm very proud of the role that pioneering Liberal William Beveridge played. Oh yes, of course it was the Beveridge Report, wasn't it? In developing a comprehensive national health service. I would not want to see that service undermined or money funneled to private providers for services that could reasonably be handled within the NHS. And he is absolutely right. They're not going out to a specialist. Now, you may have in the private sector a particular specialist for whom the NHS, it wouldn't be worth paying him a salary because he gets so few cases a year, but in the private sector he gets his fine, no issues. And so they'll use for the occasional private use. There is an argument, and I completely agree that there is an argument for an occasional specific case where there is an absolute specialist that's the only one who can do it kind of thing. But for general stuff, for general day-to-day stuff to be foisted out to a private clinic or multiple clinics does seem very much against both the spirit of the NHS and the very, very loud claims they make, that the SNP make, that the NHS is improving under their watch. It's quite clearly not, especially when you're putting £130 million into the hands of private medicine. Anyway, I shall round off there and come up, and we'll round off this video. But it's just another fail, really, isn't it? Another fail in the catalogue of fails from the worst, still currently the worst health secretary of them all. But Jenny Gilruth, she's going to have a go. Here goes up, anyway. I mean, yeah, the jury's still out on how good Jenny Gilruth will be, but she's failed at everything else. She is like Humza Yousaf. She's had a series of portfolios, and every one has been an absolute disaster. So don't hold me breath. But it just goes to show, though, the utter rank hypocrisy of the SNP. Look at us. We're shaving this. We're getting the waiting list down, but they're doing it at such an expensive cost for a very temporary fix. Because now the money isn't in the NHS. The wait list will grow again because they haven't got the funds and the ability and the resources to get through the people as quickly as they like. What they need really is another pandemic, isn't it? If you watch my last video about that, you'll see why I'm saying it. And if you haven't seen my last video about the pandemic, do go along and look. It's all about what Merlin, my contact, said, and it's a long video, but it is definitely worth the watching because right at the end, there's information in there that you won't see anywhere else. We've released that. Anyway, Thank you very much for watching. If you like what you see here on the channel, please hit the subscribe button, ring the bell, leave a like, leave a comment, please share the video. And until next time, stay safe, stay well, and remember, if you lose the NHS, it's gone forever. And goodbye.